Everyone is at risk. Whoever is positive, negative is at risk of getting HIV.
Pata HIV nimepata kama niko na hii mimba, ndio nimekuja nikajua niko nayo hali yangu.
Nikaweza kuanza miadarati, that is dawa za kulevya, heroin.
Kwenda na wasee ndio wanilipe ndio niende ninunue dawa.
Kila kitu yako, maisha yako yote. Yani everything, it destroys you.
Nairobi, the city in the sun. Only a decade ago, Nairobi had a population of about 2 million. Today, this number has doubled. While the country's capital is an expanding and dynamic hub, drawing people from across the country, the African region and the world, and generating opportunities for innovation, the rapid growth of urban areas such as Nairobi also brings particular issues in terms of preventing and managing diseases such as HIV. By the end of 2018, Nairobi City County had over 190,000 residents living with HIV, out of which 8,137 were children of less than 14 years of age.
For the population of over 4 million, we need to identify these patients. So we do testing and counseling in our health facilities, and also we give outpatients outreach services at community level.
With this in mind, on 1st December 2014, Nairobi joined other cities around the world in signing the Paris Declaration, a key part of the Global Fast Track Cities, the Ending of AIDS Epidemic campaign. The ideology of the Fast Track Cities is in essence the making of tangible progress towards the 1990 targets of 90% of people living with HIV knowing their HIV status, 90% of people who know their HIV positive status accessing treatment, and 90% of people on treatment having suppressed viral loads.
Under the 1990, we have scaled up care and treatment services for adults and even adolescents. And some of the gains that we have made for the adults is having support groups that walk the journey, having peer mentors that support the HIV positive people, and having HIV clinical support center.
When we look at the operation 1990-19, we have actually increased the testing sites, which improves in actually tracking the number of patients that are tested and actually found to be HIV positive. So they are linked to the CCC, and after the linkage, they are initiated onto care.
The Constitution of Kenya calls for the highest attainable standards of health for its citizens, while the Kenya's Development Plan Vision 2030 recognizes HIV/AIDS as one of the greatest threats to health and development in the country.
Like last year, 2017, we are talking of a total of around 2,587 young people who got infected in 1 year. If we are to put that into practical terms, we are talking of almost 185 Nissans or 14-seaters carrying people who got infected just in 1 year.
Partners like UNAIDS and other stakeholders have come in to ensure that HIV/AIDS is fought out to the core and thus usher in a HIV-free generation to thrive. To this end, increasing HIV testing and linkage to care has been key.
We carry out these activities because of partners. We have Afya Jijini, we have of course the UNAIDS, we have the University of Maryland. We also have other partners who come in not only for the HIV/AIDS programs.
Riding on the fact that no baby should be infected with HIV at birth, Nairobi County, with support from UNAIDS, is scaling up prevention of mother-to-child transmission services. The county is following closely on the national HIV targets, that is, 0 HIV infections at birth for all babies.
Nilipojua hali yangu, nikakuja hapa, na walipojua ujauzito wangu, waliniambia uko tu sawa.
but tutaku advice venye utaishi na venye utalinda mtoto wako na venye utatumia madawa yako kwa usalama ndio ujilinde vizuri na pia mtoto wako.
We have registered 162 moms in our PMTCT clinic. The ones that we are still having, all the babies have registered a negative outcome. That means that of all the moms whom we have been working along with, none of the babies have turned out positive.
But HIV elimination targets are not only for women. Men are critical shareholders in reducing the prevalence by 90% in all aspects of HIV prevention, treatment, and care. In prevention, it is a fact that male circumcision reduces the risk of female-to-male HIV transmission by about 60%. Even in traditionally circumcising communities, the practice should be carried out in a safe and hygienic condition, and it should be encouraged before sexual debut. To date, all sub-counties have introduced isoniazid preventive therapy, IPT, and more than 300 healthcare workers have been trained on the administration of it. In 2017, the county had a total of 6,000 patients on IPT.
We give isoniazid for a period of 6 months to prevent them from getting TB. However, we also do active case finding and screening within our CCC of all people living with HIV, so we can identify early anybody who's showing symptoms of TB, and we're able to do a test, either gene expert or TB lamb, and be able to find out if someone is suffering from TB. Right now, if you look at our screening rates, we are over 90% screening in the HIV clinic, and treatment for those who are both commodities, we are at 100%.
Ikiwa leo ninabeba kama mzigo nikawekelea hapa, hiko wakati singebeba kitu hivi, hata kujikisikilia kwa pikipiki nikiletwa hapa, nilikuwa ninasindwa upande, na leo hata choka ninachukua, ninapazua kuni, ninafanya kazi.
Alongside the continuous counseling and testing, Nairobi City County is focusing on increasing HIV testing and cares among key populations.
My name is Julia Mushiri. I'm a sex worker. I get a lot of risk when I'm at work. I have to use PrEP because wherever the condom bursts or I have someone who doesn't want to use protection, I'll always be safe on my side of HIV because it's helping us who are negative to remain negative.
The bar hostesses is to represent the waiters. It's like a cool name for the waiters. Since July 2017, we've managed to enroll 4,200 female sex workers in our program, and we've done quite a number of interventions with them to prevent HIV and also to make sure that their livelihood is okay as a person.
I used to have multiple partners. I didn't use the condom. But when I realized, after realizing that I was HIV positive and being cancelled, these days, I normally use the condom.
They treat us in a very, very, very nice way, which is non-discriminatory, because we used to go to a standalone clinics. For now, we don't go to standalone clinics. We come here because we feel this is our home, this is our hospital, and we need to be treated as Kenyans.
Most of wenye wanatumia miadarati huwa wanashoot, na unaweza sikia wanatumia syringe moja ama ile mwiba ni moja. Mtaani tunaitaga kidengi.
Vengara Mart Clinic opened on January 31st, 2017 and enrolled 77 clients in the first 3 months. The clinic offers methadone and services for other medical conditions, including NCDs and STIs, as well as referrals to other services as needed.
It works the same as the heroin, but it has lesser withdrawal effects, and it acts longer in the body, so they can have a normal life.
Tangu nianze methadone, nimeona tofauti sana. Jo wakati huo ukiniona nikitumia drugs na saa hii unaona tofauti. Jo nimechange.
The Ngara Mat Clinic uses a model that works closely with civil society organizations, CSOs, to identify and track the progress of clients.
One of our success is that the clients who came in positive are the only ones who are still positive. We've not had any new HIV diagnosis in the institution since they came here.
There are 9.2 million adolescents and young people aged 15 to 24 years in Kenya. This is close to 20% of Kenya's total population. This is a key demography whose health status directly affects the socioeconomic status of the country.
What we are doing is creating awareness to the youth that there is HIV and HIV is real. How we can prevent HIV from spreading.
Through partnerships with civil society and the UN Joint Team, more than 75,000 adolescents aged 10 to 19 years and youth between 20 to 24 years in Nairobi have been reached with information and counseling on HIV, sexual reproductive health and awareness on gender-based violence through the One-to-One Integrated Digital Platform (OIDP), with components of web and mobile-based features.
If you want to access the reproductive health services or the drug and substance abuse services with your phone, you can just come to your phone. We have come up with an application, a mobile application known as Mute. In this application, you can book an appointment with a health provider. You can book an appointment with a peer counselor.
All these people, and also the ones like you who are HIV positive, you are
Youth-friendly facilities and services have been established within all the sub-counties. Adolescent clinics, both in public and private facilities, have been initiated as one-stop shops in different sites where adolescents living with HIV can access quality and friendly services.
Ever since I started taking my medicines, I've been trying my best not to miss, because when I came in, I was very, very sick, but now I'm healthy. Even my weight has increased and my health has increased, my nutrition has increased, all because of coming to this hospital.
Since Dreams came in, it has really helped me a lot. It has empowered me, taking me through trainings which has helped me a lot.
We started by training these dream girls to become peer mentors, so that we were saying once we train them to be peer mentors and then we place them in our facilities, then the adolescent and young person who is coming in this facility will be able to easily identify with this peer mentor, and then they are able to have a discussion. We are able to recruit more adolescent and young people to go for HIV testing, even if that was not their main agenda of coming to the facility. That way, it then means we are not having missed opportunities in terms of HIV testing.
Appropriate health services cannot be achieved without quality data from the various health facilities or even from the community health volunteers. To this end, the county, working closely with partners, has put in place ways of quality data collection and appropriate routine data quality audits.
So what we've done is to try and bring electronic medical record systems, and we've been able to achieve that in about 33 sites, and we are scaling up to another 15. The fact that we are moving electronic will mean less data errors, also help us in defaulter tracing, because at the click of a button, you can tell who did not come for an appointment.
Celebrating achievements not only creates space for critical reviewing and monitoring progress for greater success, but also facilitates the adoption of more systematic approaches to safeguard the progress made. The Fast Track 1990 in Cities approach has thus catalyzed a positive momentum, with partners happily joining the move towards strategic results. Much will be achieved with more resources and collaborations in place. For now, it has not been in vain. The results are a marvel.